All right, time to dive into all things Novocaine today. We're going to unpack everything about this stuff,
Yeah,
from what it even is to how it works, and even some tips to deal with that Novocaine afterwards.
right.
Whether you're prepping for a dentist appointment, curious about anesthetics in general, or just love knowing more,
hmm
we've got you covered.
Yeah. And, it's funny how people say Novocaine like it's the only thing out there.
Yeah.
But it's actually just a brand name for procaine, right? And dentists use a bunch of different local anesthetics these days.
Oh, okay. What else is there?
Well, lidocaine is one you've probably heard of.
Yeah, I think so.
And there are reasons why it's kind of taken over as the go-to.
Oh, interesting. So is lidocaine the new and improved Novocaine then? What's the difference?
Well, a couple things. It seemed to have a lower chance of people having allergic reactions, which is huge, and it also numbs things for longer.
Oh, that makes sense.
But the main thing is, both of them, how they work, is basically blocking those pain signals your nerves are trying to send to your brain. You know?
Oh, I see. So it's like hitting the pause button on pain
Exactly.
so the dentist can work and you don't feel a thing.
Yeah. It's a pretty amazing system when you think about it.
It really is. But hold on, if lidocaine lasts longer, does that mean I'm walking around with a numb face for hours after the dentist?
Haha, not necessarily. Lidocaine's effects can stick around for 60 to 120 minutes, yeah.
Okay.
But with Novocaine, it's usually gone within 30 to 60.
Gotcha.
But everyone's a bit different, how big the area is that they're numbing, the dose. Even your metabolism can play a role.
Wait, metabolism? You mean some people process Novocaine differently than others?
Yeah, totally. Isn't that wild? About 1 in 5,000 people, mostly of Jewish or Alaska Native heritage, have this genetic thing where Novocaine lasts longer because their body breaks it down slow.
Wow. No kidding. I never knew that.
It's pretty fast.
It is. So, besides just waiting patiently, are there any tricks to make that numbness go away faster when it's lingering?
Well, some gentle exercise or lightly massaging your face can get the blood flowing there, which might help.
Okay.
A warm compress is another option. And sometimes dentists can use a special reversal agent, like Ortiverse, to speed things up.
Oh, that's good to know. Is that mostly for kids or?
It can be, yeah, especially for kids who might bite their cheek while they're numb and not realize it.
Oh, right. Yeah, that makes sense.
But it can be helpful in other situations, too.
Okay, good to know. Now, let's talk side effects. I've totally felt that tingly feeling before. Is that normal?
Oh, yeah, you're definitely not alone. That tingling, maybe a bit of pain where they injected it, that's pretty common.
Okay.
Some folks get headaches, dizziness, even muscle twitches, and that adrenaline rush some people feel. It's probably from the epinephrine that's often mixed with Novocaine to make it last longer.
Aha, so that explains it. Now, what about the serious stuff, like allergic reactions?
Thankfully, serious allergic reactions are super rare, but it's smart to know the signs, just in case.
Yeah, for sure.
Things like itching, hives, trouble breathing, or swelling.
Oh, yeah.
If you experience any of that, call a doctor ASAP, of course.
Okay, good to know. It's reassuring that it's rare, but always good to be aware.
Definitely.
So, while we're on the topic of safety, any things to avoid while you're numb?
Oh yeah, good point. Hot food and drinks are a no-no because you might not be able to tell how hot they are.
Right.
Same goes for chewy foods that can be hard to deal with when your mouth is numb.
Makes sense. I'm glad we covered that.
Me too. Important stuff.
Now, this might sound kind of silly, but is there any chance of, getting hooked on Novocaine?
Haha, it's a question that comes up and it's good to talk about it.
Yeah.
The straight answer is no. It's not addictive in the way we usually think of addiction.
Okay.
The numbness can feel unique or even nice for some, but it doesn't work like drugs that mess with your brain's reward system.
I see.
You know those stories about people getting dental work just for the Novocaine?
Yeah.
Those are probably more about other things going on, maybe psychological stuff or wanting attention.
That's interesting.
And dentists are trained to recognize these situations and have guidelines to prevent unnecessary procedures.
That's good to hear. Well, we've covered how Novocaine works, the effects, the safety stuff,
Hmm?
but I'm curious about its history, how we even started using it in the first place.
That's a fascinating story. Takes us back to the early 1900s when pain management during dental work was a whole different ballgame.
I bet. I can only imagine. So, are we ready for a little time travel?
Let's do it.
Great. Then let's dive into that history in part 2. See you soon.
Welcome back. So, ready to jump back in time and see how Novocaine changed dentistry.
Definitely. Take us back. How did it revolutionize things?
All right, so picture this. Going to the dentist meant serious pain, right? Extractions, fillings, even just cleaning. Nothing like today.
Oof. Yeah, I can't say I envy them.
Right. So where it all began was with this German chemist, Alfred Einhorn, back in 1904.
Okay.
He synthesized procaine, the stuff we call Novocaine.
Oh, so it didn't start with that name. Interesting.
Nope. It was Heinrich Braun, a surgeon who saw its potential as an anesthetic. He came up with Novocaine.
Novocaine, huh?
Yeah. From the Latin novus for new and cane, that ending you see on lots of anesthetics.
Clever. Brand new anesthetic.
Exactly. And it was a game changer, truly.
Yeah, I bet.
Novocaine meant dentists could do their work with way less pain, so more people went to the dentist, less scary for everyone.
Makes sense. No more wrestling patients or using those, I don't know, questionable old methods to deal with the pain.
Exactly, a turning point for sure. And get this, it wasn't just dentistry either.
Really?
Novocaine was used for minor surgeries, blocking nerves, even childbirth, to help with the pain.
Wow, well, it went way beyond the dentist's chair.
Time. But of course, like with anything new, there were worries at first.
Yeah, about safety and side effects, I'm sure.
Exactly. It was a new drug. People wanted to know what the long-term effects might be. That's understandable.
Makes sense. You don't just jump into using something new without knowing the whole story.
For sure. But as time went on, research happened, dentists got more familiar with it. It became clear that Novocaine, when used correctly, it was safe and it worked.
And that's what led to it becoming so widely used.
Right, and eventually to newer anesthetics like lidocaine, which we talked about.
Makes sense.
So Novocaine might not be the most popular choice now, but it definitely changed dentistry forever.
It really did pave the way.
Totally. It changed how we think about dealing with pain and set the stage for even better anesthetics to come.
It's amazing how one discovery can have that ripple effect, changing a whole field.
It really is. But speaking of advancements, where do we go from here? What's the future of these anesthetics?
Ooh, good question. What do you think?
Well, Novocaine's great, but research never stops, right?
Right.
They're always looking to make things work better, fewer side effects, a better experience overall.
So paint me a picture. What could these future advancements look like? Are we talking totally pain-free dentistry?
I mean, that's the dream, right?
Yeah.
Completely getting rid of all sensation might be tough, but imagine anesthetics that work super fast,
Okay.
like almost instant numbing, or ones tailored for each procedure or even each person.
Wow.
So you get the best effect with minimal side effects.
That would be incredible. No more waiting for it to kick in. No more weird tingly feelings.
Exactly. They're also looking into longer lasting ones, maybe one injection for a long procedure.
Oh, that would be amazing, especially for people with dental anxiety.
Right. Less poking and prodding. Who wouldn't want that?
For sure. Okay, but let's get really futuristic. What about things like lasers or even that electronic anesthesia and VR stuff you mentioned before?
Oh, the possibilities are wild. Imagine picking your own calming VR experience while they're doing a filling.
Haha, that's so cool.
Or what if they could just spray on the anesthetic, no needles needed?
Okay, that sounds almost too good to be true.
I know, right? But anything that makes going to the dentist easier, I'm all for it.
Me too, for sure. So it sounds like a pretty exciting time for dental anesthetics.
It really is. Who knows what amazing discoveries are coming next?
Right. Maybe pain-free dentistry isn't just a dream anymore.
Maybe not.
Well, we've covered so much about Novocaine's journey today, from its revolutionary start to these amazing possibilities for the future.
It's quite a story.
It is. We went from the old days of pain to a potential future where it's basically pain-free.
Amazing how far we've come.
And it all started with that one discovery, Novocaine.
Yep.
It shows how curiosity and wanting to improve people's lives can lead to these breakthroughs.
Couldn't have said it better myself. It reminds us that even discoveries that seem small can change things in ways we never imagined.
So true. Well, I think it's time to wrap up part 2 of our Novocaine deep dive.
Sounds good.
We've learned how this one thing revolutionized dentistry and set the stage for a future with better, less invasive pain management. But before we get too far ahead of ourselves, I think it's important to step it and see how Novocaine has affected our culture as a whole.
Oh, good point.
How has it changed how we think about going to the dentist?
Yeah,
And how does pop culture portray it?
those are great questions and the perfect topics for part 3 of our deep dive.
Awesome. So stay tuned for the final part. We'll be back soon to unpack the cultural impact of this game-changing anesthetic. We're back for the final part of our Novocaine journey. We've covered the science, the history, even what's next.
Right.
But now let's switch gears a bit and look at something different, how Novocaine has impacted our culture.
It's interesting, isn't it, how it's kind of become part of our everyday conversations?
Yeah.
Movies, TV shows, even stand-up comedy. Novocaine pops up everywhere.
It really does. I've heard those jokes about leaving the dentist with a numb face trying to talk.
Haha, yeah.
It's like a classic, something we've all experienced.
This shared experience, and that says a lot about Novocaine's impact, you know?
Yeah, for sure.
It's the thing people think of with dental procedures, even with all the new anesthetics out there.
That's true. So how has it, or even just the idea of numbing things at the dentist, changed how we see dental care in general?
Well, before Novocaine, going to the dentist was all about dread and pain, right? People put it off as long as they could.
Oof, yeah.
But then effective anesthesia comes along and things start to change.
It became more accessible, less scary, part of your routine.
Exactly. And you see this reflected in movies and TV, too.
Oh, yeah.
Characters mention getting a filling or a root canal. No big deal, no dramatic pain like in the old days.
Yeah, you're right. It's just a normal thing now.
And that is a big shift. It shows how Novocaine and dental anesthesia overall made going to the dentist normal, part of staying healthy.
You could say it took the sting out of it, literally and figuratively.
Haha, for sure. But beyond that, Novocaine has also become a symbol.
Oh, of what?
This temporary escape from pain or discomfort.
Interesting.
Think about how we use it in metaphors. Numbing the pain of something, wanting a Novocaine shot for emotional stuff.
Oh, yeah, yeah.
It's like shorthand for wanting relief, to switch off those bad feelings for a bit.
It's true. So it's not just about the literal medical use anymore.
Exactly. It's taken on this deeper meaning in our language and culture.
It's like Novocaine went from numbing pain to representing this idea of control, managing discomfort.
You got it. And not just physical pain either.
Right, right.
We see it in how people talk about coping with tough times, emotional or psychological stuff, using Novocaine as a metaphor.
It's become a symbol of resilience, finding ways to deal with the rough parts of life.
Totally. And it's amazing how something like an anesthetic could have this kind of impact on us.
It shows how even simple discoveries can change things in ways we wouldn't expect, not just our health, but our language, how we see things, our culture.
Absolutely. Novocaine's story is all about how science, culture, and just being human are all connected.
Well, I think we've explored a lot in this deep dive, from how Novocaine works at a tiny level to its history, the future of anesthetics, and even the surprising cultural impact.
It's been quite a journey.
It really has. Novocaine's more than just something that numbs you.
Mm-hmm.
It's something that changed things, a symbol of progress.
I like that.
And a reminder that even small discoveries can have a huge impact on the world.
Couldn't agree more. As we wrap up, think about other everyday things around you.
Yeah.
What's their story? What kind of hidden impact do they have on our lives and culture?
It's a good reminder that there's always more to discover, more to explore, even in the most ordinary things.
Exactly. Well, thanks for joining us on this exploration of Novocaine.
We're glad you came along for the ride. Until next time, keep exploring, keep asking questions, and keep diving deep.